Good morning, colleagues. Good morning, everybody. Thanks for joining the
Morning.
webinar. Just to let you know that we'll be starting at 10 a.m. I'll be giving a few announcements as we go through the webinar. The first thing is I'll be kindly asking everybody to have your microphones on mute all the time. On WebEx, when your microphone is muted, it shows the microphone icon in red. So if it's not showing red, this means that your microphone is open. The same for camera. So if you have a camera on, we would be grateful if you also could turn it off because we have full house also. We are expecting a large number of participants. We will be also tracking the webinar as we go. So if there are background noises, we'll be coming back and managing microphones. I want to see if my colleagues that are following through Facebook, this webinar will be streamed over Facebook. I just want to check if they can hear us. Colleagues, if you are on Facebook, can you just let me know if you can, if you are hearing it well? If you can see the slides as well.
Yes, Nayara, everything looks fine on Facebook. I just verified.
Great. Thank you so much, Pedrag. Can we show the other slide then? Thank you so much. So we will be coming back in 5 minutes to start the webinar. So thank you so much. Morning again to all colleagues who are connecting to the webinar. We will be starting very, very soon. I just think I saw the connection from the Undersecretary General Fabrizio Hochschild. I just want to check your video and audio. If you could unmute yourself so we can make a test. If you're ready.
Ministerial declaration.
There's one more question that is also a general one. If you wouldn't mind, I'd like to.
Sorry, this is a sound check. Fabrizio here. Can you hear me all right? I don't hear you.
Yes,
Yes.
Mr. Hochschild, we can hear you. Thank you.
Thank you
We
so
can
much.
hear you and see you perfectly. Thanks.
We'll be starting in 2 minutes. In the meantime, colleagues, I'll be giving you this message throughout the process. Please do keep your microphones closed all the time if you are not speaking. You can see there is an icon on WebEx that shows a small microphone. It's a sign. It should be in red. If it's not red, this means your mic is open. We also would suggest to all participants to keep your cameras off as well, unless not to the speakers. Please do keep your cameras on whenever you are speaking. And yes, so we'll be starting in just 1 more minute. We're just waiting for more colleagues to connect to the webinar. Thank you so much. Good morning, good evening, good day to everybody. My name is Nayara Costa. I'll be your moderator today. I'm from DESA. Welcome to, before I start, Pedro, can we start recording, please? And also we can move to the next slide, please. So thank you all for joining. This is the second webinar organized by the United Nations Department on Economic and Social Affairs, UNDESA, on COVID-19. The theme for this webinar will be strengthening science and technology and addressing inequalities. So we want to thank all the participants for joining the call. We are expecting a good number of participants to join. We had a good number of registrations as well. More than 1,000 people registered for this webinar from more than 130 countries as well. This call is being streamed through two platforms. You can follow it through WebEx, and also it's been live streamed to Facebook Live. As you can also see, this call is being recorded, and the link to the recording, as well as to the PowerPoint presentations and links to the policy briefs that will be mentioned, will be posted at the DESA website very shortly. We will also be sending the links directly to those who have registered to attend the webinar. If you have questions, comments, suggestions, please, for those at the WebEx platform, you can use the chat box. Please make sure to add your name, your country, your organization, and if you are addressing questions to someone specifically, do let this person put the name of the person as well. We have a team of colleagues that will be monitoring the chat box on WebEx and also the comments on Facebook Live. So feel free to participate and to engage. Once again, and this is something I'll be reminding you all, please do keep your microphones closed and muted all the time if you are not speaking. The same applies to cameras. We would be grateful if you're not speaking to keep your cameras off during the whole webinar. Can we go to the next slide? So this webinar is organized into main sessions. We will have some welcome remarks by our Assistant Secretary General, and we also have a special guest, the Undersecretary General, Mr. Fabrizio Hochschild. He'll be giving some messages about the United Nations 75th anniversary very shortly. Then we have two sessions at this webinar. One session will be focusing on science, technology, and COVID-19 responses, and we have DESA colleagues that will be presenting some briefings on this topic. This will be followed by a Q&A where you can add your questions and comments to the speakers. Can we move to the next slide, please? And then we'll have a second session, which will be focusing on COVID-19 and inequality. And then we have another presentation by two DESA colleagues, followed by a Q&A. And the webinar will close at 12 p.m. New York time. So without further ado, and I know that USG Hochschild has also to leave very shortly. Let me give the floor to Mrs. Maria-Francesca Spatolisano, the Assistant Secretary General for Policy Coordination and Interagency Affairs from DESA. We can also move to the next slide, please. Mrs. Spatolisano will be giving some keynote remarks, and she will also be introducing our guest as well. ASG Spatolisano, the floor is yours. Thank you.
Thank you, Nayara, and good morning, good afternoon, everybody. Ladies and gentlemen, thank you all for joining us at this challenging time. I welcome you to the second DESA webinar on the impacts of the COVID-19 crisis and on the way forward. This is a colossal human tragedy. The latest figures put the global number of cases at about 3.5 million and around 250,000 deaths. So no country or population group is safe. In addition to the effects on lives and health, the pandemic is also having dramatic impacts on economic activity and livelihoods. At our last webinar, we presented and discussed some of the socioeconomic impacts of the crisis, and we continue this discussion today. But we also talk about how we can strengthen our responses to the pandemic in ways to continue and deliver.
Apologies. Sorry, Mrs.
And step onto the path towards recovery. This crisis demands a swift and coherent action, but also learning from each other and better collaboration among stakeholders and countries. This is also a time where the consequences of making uninformed or misinformed decisions could be immense. So we must draw from the best scientific evidence available and act to protect lives and livelihoods today and ensure also we build back better for tomorrow. The first session of this webinar will discuss how to do this in the context of science and technology and in their interface with policy and society. Better cooperation around finding and sharing solutions is key. For example, governments are quickly adopting digital technologies to confront the COVID-19 pandemic, and they have adopted tracking applications, health checks for symptoms, or similar ones can be scaled up further. But attention must also be given to the challenges and multiple digital divides that are being brought to the fore, or we risk further isolating the poorest and most vulnerable groups. And indeed, the second part of today's webinar, we will focus on the vast existing inequalities being laid bare by the pandemic and exacerbated by it. All people are at risk, but exposures to the virus, vulnerabilities when infected, and ability to cope are different across different groups. The poor, women, indigenous people, older people are among those facing disproportionately worse outcomes. So as the crisis brings awareness of the risk of inadequate public service or deficient social policies, this can also be a transformative moment. We can use this awareness to turn the tide against rising inequalities. Ensuring universal access to quality public services like healthcare and strengthening social protection systems is a first step towards building more equitable societies. Dear colleagues, taken together, the briefs that are the focus of this webinar send a cohesive and important message. The COVID crisis demands immediate action with swift innovations, sharing knowledge, and applying the best available science and technology. And it is also a chance to recognize deficiencies, work to build trust in science, and make digital technologies accessible and responsive to the most urgent needs, and ensure that new treatments and vaccines are available to all. In other words, all of our actions must have at their center the need to ensure that no one is left behind, and that our recovery also help advance progress towards the Sustainable Development Goals. The UN Department of Economic and Social Affairs promotes great collaboration across stakeholders from all sectors towards these goals and supports building capacity to achieve them. Now, as you know, the United Nations this year celebrates 75 years since its creation. And much has changed in these 75 years, and much more change is to be expected. We all wonder, what is the world going to look like in the near future? And what is the UN role? What is we want the UN to be able to do for us in this new world? I have the distinct pleasure to invite Mr. Fabrizio Hochschild, the Under-Secretary General, advisor to the Secretary General, on the preparation for the commemoration of the United Nations 75th anniversary, to take the floor. He will be with us briefly, and he will set the stage for our webinar. Fabrizio, the floor is yours.
Thank you very much, Nigeria. Thank you very much, Maria-Francesca, and a warm greeting to all the participants. I hope you're all safe these difficult times. I'd like to begin by congratulating DESA on taking this initiative. I think these discussions are tremendously important, and we need to connect better across all stakeholder groups to ensure that our science is used for good and that we contain abuse or illegal use. Of science, I think the importance of science against the backdrop of this pandemic has once again come to public attention. And I don't think we can underestimate the absolute critical use, not just of science, but of international collaboration in science. It's that international collaboration that is going to bring us a vaccine. It's that international collaboration that is influencing policy to save lives at the moment. Within science, the area that has perhaps helped us most is digital. This is the first crisis in the digital era, the first global crisis. And digital, at least for those connected, has quite literally been a lifesaver. It's allowed us to continue work. It's allowed us to continue meetings like this. It's allowed us to stay connected with our families. It's allowed our kids to stay studying. But, it's also highlighted the cost and the price of the digital divide. And I'd like to highlight two aspects. One is that half the world cannot benefit from those advantages. And if we look at it through a gender perspective, in the case of women, it's 60% or more of women who cannot benefit. And the second aspect is that many people do not have jobs that are conducive to being digitalized. So even within communities where digital access is possible, those who have jobs that can't be digitalized will be left further behind. So as much as digital has been a lifesaver for so many of us, the COVID is going to bring to the fore the pain of the digital divide, and inequalities will grow as a result of that. I think the third aspect that I want to highlight is the risk of increased attacks and harms online. We're working with ITU on this, and it's become apparent that the increased online presence has also led to increased online security risks, increased online child abuse. So that's the third aspect I think we need to be concerned about. But I think what's most important is that we overcome the digital divide. We will not succeed in the implementation of the SDGs unless we provide affordable, safe, and reliable internet access to all. And I think that has to be one of our main priorities moving forward. And I think the 75th anniversary of the UN, where the Secretary General is very keen to position the UN to hear from the world about their priorities, but to position the UN not only to deal with the many problems it's inherited, but to deal with emerging problems like the challenges and opportunities placed by the digital world. I think the 75th anniversary is a starting point for much greater attention, because it's only through international cooperation and inter-stakeholder cooperation, like we're having with this initiative of DESA, that we will be able to overcome that digital divide and move forward with the SDGs and reduce one of the greatest threats of our times, and that's growing inequalities. So once again, I'd like to express the hope that you're all safe. I'd like to thank you for participating, and I'd like to congratulate my dear colleagues from DESA for this initiative. Thank you.
Thank you very much, Undersecretary General Hochschild Ramon, for joining this webinar today. We understand that you have a series of other meetings on your schedule, and thank you so much for allocating some time to join our webinar again. So let's move to the first session of the webinar, and I think it will fit very nicely from what we just heard from USG Hochschild Ramon. Can we move to the next slide, please? And again, just a kind reminder to everybody to keep your microphones off. To the speakers, if you start hearing background noises, please, you can stop. We will mute everybody, and then we will unmute you again, or we will ask you that you can unmute yourself, okay? So the first session of the webinar will be addressing the topic of science, technology, and COVID-19 responses. We have two presentations. And as we go, please feel free to use the chat boxes to add your comments and questions. Remember to put your names, organization, and country so we know where you are. The first presentation, we will address the theme, the COVID-19 pandemic, a wake-up call. for better cooperation at the Science Policy Society interface. You can access the brief paper at the UNDESA COVID-19 dedicated website that we shown on the slide as well. Can we move to the next slide, please? So I would like to invite our first speaker, Mr. Shantanu Mukherjee, who is Chief of the Integrated Policy Analysis Branch of the Division for Sustainable Development Goals, the SDG, at UNDESA for his presentation. Shantanu, you have the floor. Thank you.
Thank you, Naira. And dear colleagues and friends, thank you for taking the time to join this webinar today. Let me acknowledge quickly my co-authors, Richard Alex Roll and Wei Liu, both from UNDESA. And let me also acknowledge our many collaborators from whom we constantly learn so much, all of the technology facilitation mechanism members, including our dear colleagues in the interagency task team, communities such as the Inter-Academy Partnership and the International Science Council, and external experts whose knowledge and experience is such a valuable resource for us. Needless to say, they are not responsible for what I'm going to say here today, so feel free to disagree, please. Just to anchor ourselves, Pedra, can we have the first slide, please? Yes, the Science Policy Society interface is clearly complex and it encompasses many actors. To simplify, and for the purpose of our discussion today, we are viewing it as a critical part of the way in which objective knowledge is translated into well-being. Now, you may not always have thought about it, but it's something that's impacted your life from birth. For example, when ministries have taken the advice of agricultural scientists and framed policies around food production, or when citizens have changed the patterns of their food consumption in response to scientific findings, which has now again changed how policies are set. So you can see that there are many entities involved in it, not just scientists and policymakers, but also businesses, social organizations, the media, and so on. It is also something that's quite dynamic and evolving, with each part capable of influencing the others. And of course, the interface is active, not just in national or local contexts, but also in global ones. Next slide, please. So our brief draws upon what we are learning from the pandemic experience to arrive at 5 sets of recommendations, which I will present very briefly here. First recommendation is to recognize that there's room for improvement in all countries on how science-based decisions are made. Country contexts are different, and so are cultural values and norms. In some countries, institutional structures like science policy advisory positions in government are weak or missing. But more generally, we find that most countries could strengthen how they bring in science advice from different disciplines to inform policy, especially in something like COVID, where there are big trade-offs to be managed as the policies are set. It is also important that all of this based on evidence and information, including about different population groups that may be affected differently. For example, by now it's well understood that the impacts of COVID on women may be quite different from those on men. And they don't have anything much to, and they do have something much to do with the disease itself, but also with the social circumstances that women find themselves in. And it's important to be able to get the evidence for this to work properly. And of course, the more transparent and open the advice is, the stronger are the chances of there being trust in both scientists and government. Our second set of recommendations is about strengthening public trust in science. On the one hand, this means that scientists themselves must be able to communicate clearly and reach all parts of the population. So, for example, a phrase you've often heard, such as flatten the curve, it helps translate something that's actually quite complex based on models into something that's understandable and actionable that people can engage around. But at the same time, it also means, very importantly, as one of the previous speakers mentioned, that disinformation has to be countered. And this is not just by scientists, but by other societal mechanisms as well. And this is, as we all recognize, a longer-term project. Initiatives such as citizen science can help build trust across generations and into the future. Next slide, please. The third point I'd like to make here is that sharing knowledge and data openly is essential for broader collaborations and quicker results. We are seeing this very graphically with COVID, where peer-reviewed academic research is being shared without the normal barrier of journal subscription fees. And as a result, we are seeing an explosion in how research is being conducted across continents and countries with much quicker results. And other forms of collaboration are also emerging. We mentioned some of these in our brief. A key takeaway for the future is how to set up norms for this kind of open science that can help connect researchers from across both developing and developed countries, increase the speed with which we find solutions to our shared challenges. But at the same time, on the societal side, there is a flip side. Initial research findings can sometimes turn out to be wrong or invalid, and that's the way science works. But if they're rapidly disseminated, then it's also prone to being misinterpreted. There is therefore a need then for the public to also become more conscious and aware consumers of science. Our fourth point is that we need proactive measures for universal access to solutions. On the one hand, we see there is good coordination, multi-stakeholder and multilateral collaboration around developing treatments and vaccines, and several initiatives are underway here. Of course, we feel this must continue. At the same time, even though a vaccine or a medical treatment is a global public good, our past experience shows that this does not automatically mean there'll be fair and universal access. There are good practices here, such as with the Global Vaccine Alliance, and we feel very strongly that these practices should be drawn upon so that there is fair and universal access to treatments when they become available. Treatments are not the only way to solve the problem. There are other solutions as well, and many of these are based on digital technology. We feel also that these should be made more widely available through established and trusted networks so that countries can learn from them and incorporate them. And the second presentation today by my colleague Denise will pick up some of those. Our final point is that we have to act with greater urgency on global scientific assessments. These assessments, whether in the field of health or sustainability or climate, they're all powerful ways to present scientific consensus and evidence around shared challenges. But there often seem to be very long time lags before they're translated into action. We need to do better at this, both at the national level and in global fora. One example of a recent positive development here has been with the Global Sustainable Development Report, which came out last year in September and really helped guide the discussion at the UN, at the SDG summit, but also in the ways in which the UN is thinking about the follow-up and review process for the 2030 agenda, not just in the UN, I must add, but in many other countries. But we need more of this to happen with some of the other pressing challenges and assessments we have. I hope I've convinced you that there are many ways in which to get involved in improving the science policy society interface. Here at the United Nations, we are involved with our partners in some of them. I invite you to find out more through our website at the Technology Facilitation Mechanism. But more broadly, this is something where everyone can and must play a role, not just for recovering from the pandemic, but for strengthening the way in which we develop human well-being into the future. Thank you.
Thank you very much, Shantanu, for that. Just before I move to our next speaker, and perhaps we can already move to the next slide, one of my reminders to everybody, please keep your microphones muted all the time. We would be also grateful if you could turn off your cameras as well. If you see some, blue small waves icons coming from your name, this means that your microphone is open. It should be a red icon. I think I'm hearing, I don't know if it's Denise that I'm hearing, because otherwise we can mute everybody. Okay, so I think we can go ahead. Thanks, Vedrak. Our next speaker will present the main findings of the policy brief, COVID-19, Embracing Digital Government During the Pandemic and Beyond, which also is available at the UN DESA dedicated COVID-19 webpage. Can we move to the next slide, please? So I would like to invite Mr. Denis Suzar, who is Governance and Public Administration Officer at the Digital Government Branch of the Division for Public Institutions and Digital Government at UN DESA. I think I just heard some background noise, perhaps. Can we mute everybody? And then Denis, the floor will be yours, okay?
Thank you, Naira. I hope everyone can hear clearly and everyone is also safe and coping well with the ongoing crisis. I am presenting this on behalf of Digital Government Branch and this work of entire staff in the branch and also our interns, which will eventually feed into our flagship publication, United Nations e-government survey. As USG and USG mentioned, technology is allowing people to remain connected during the crisis. I think we can confidently claim that the post-COVID world will be more digital than ever before. In that regard, digital government did also its part, and it's still doing. So governments took policy decisions based on real-time data and analytics, and also they use technologies. Next slide, please. So if you look at this graph, the bar chart in this graph shows the percentage of member states with COVID-19 related information on their national portal. And the blue line shows number of reported COVID-19 cases worldwide. As you see, we did our first check of all national portals, 193 UN member state national portals on March 25th. And then we did a few checks April 8th and April 22nd. And you see within 2 weeks, the entire national portal started providing information on the government portals. It is vital for governments to provide accurate, transparent, and up-to-date information to people, particularly during times of crisis. And as USG mentioned, fake information is a big issue, and people go to government portals during this crisis. Next slide, please. What kind of information is this? So as you can imagine, it starts with basic general health information, advice, presidential statements, and then it goes to statistics, updates about the policy curves, and it advances, and eventually we have noticed that many governments started building dedicated public COVID-19 portals, and also majority of the governments also started developing apps. I think all these engagement initiatives help people to cope better with the crisis and give them a sense of safety and support. In that regard, also we've noticed that many governments use social media platforms to connect with people. They also went to the places where people are present. Next slide, please. So after information, what we have explored is applications. So governments started building apps for mobile phones or services on the portal, like delivering food by using technology, or digital identity. One of the things some countries reported that maybe the use of digital identity increased more than 1,000% during the month of March. So what we have done in the branch is we started a call for call for COVID-19 related e-government applications. So this call started approximately 2 weeks ago, and as of yesterday, we received more than 500 different applications from close to 100 countries. So this application will turn in this database will turn into a publication very soon in our in UN DESA, and participants who are interested in checking the existing applications can follow the bit.ly link that you can see on this slide. Slide, please. So,
Denise, this is Nayara. Just to let you know that your camera is off in case you want to turn it on.
Thank you, Naira. I just turned it on. So, so what kind of applications are these? So most of these applications are can be classified as like some of them Bluetooth-based contact tracing apps. As you may heard, this is a big topic in the media, or use of AI chatbots for self-diagnosis, or many countries also introduced online permits during curfews. So people who want to go out requesting permit from the government, either through an app or SMS. And you can again refer to the website for all details. But here you see a snapshot of Arogya Setu of India. This is the contact tracing app in India, and it's also the most downloaded app in the world with 50 million downloads. And on the right, you see a map of Prague based on these contact tracing apps. The map is showing danger heat maps, like most of the COVID-19 cases in the city. So government started using these technologies very good. But also based on a study by Oxford University, for these apps to be effective, 60% of the population in a given area would need to use these apps. But of course, they have some benefits, especially in my view, AI chatbots. They reduce the pressure on healthcare institutions, and so people stop going hospitals, emergencies, but and also the apps can also warn those at high risk of developing infection. Next slide, please. And as mentioned, we have seen a lot of partnerships during this time. Many partnerships, including private sector and softwares for hackathons, we call it. So they tried to come up with these apps. Governments used hackers and private sector hackers in a positive way to come up with these apps. Also, similar to the previous presentation, we've seen some open research and data in order to tackle the COVID-19 related issues with academic stakeholders to develop new text and data mining techniques that can help scientific community answer high priority questions. So these partnerships, also international organizations, including ITU, to connect people. Again, like the USG said, 50% of people are not connected. Some mobile operators in some countries provided free access to internet during the crisis. Next slide, please. And also we've seen some new technologies, AI and 3D printing. In China, hospitals were disinfected by robots or the police using technologies. So these are all good. By the way, I don't see my slides. Next slide, please. So I just want to focus on the challenges in the last few minutes. So again, the challenges are digital divides. This came a few times, and resource constraints. So not all countries have resource or human capacity to develop these kind of applications. So partnerships are important. Misinformation or fake information. We've seen abundance of fake information also during the crisis. So in that regard, information coming from governments is important. Maybe the most popular challenge is this privacy and surveillance. So our governments, by deploying these contact tracing apps, are they really tracking people, or how efficient these apps are? So this is a big thing, and it's noted that some of these COVID contact tracing apps don't have a privacy policy, or they don't allow users to provide opt-in. So there are areas definitely need for improvement in that. We've also seen cyber attacks, especially to hospitals or the World Health Organizations, WHO, during the pandemic. So that's also one of the things. And I think this user uptake trust, maybe trust in government, is one of the challenges. Why would people start using these apps? If you can go to next slide, please. So in order to convince people, many government officials also made out calls, like you see a news item on the right from Australia, trying to convince people to install the app on their phones, saying that app to be rolled out only with privacy safeguards. Again, as I said, some countries are implementing an opt-in basis, meaning individuals have to actively confirm that they wish to participate and contribute to the solution. These are, and in some countries, public health authorities are carrying out calls with infected people and asking for their explicit consent to obtain localization data, and in case of disagreement, communication. So we have seen also actions from policymakers in that regard. So if next slide, please. All this information that we are collecting will be available in the upcoming United Nations e-government survey 2020, which will come during the summer, during the third quarter of this year. So in this survey, we measure national portals by different features according to e-government services, information, e-participation, etc. In this policy paper, we quickly looked at COVID-19 related information and apps. And as I mentioned earlier, the apps that are submitted to us by governments will also be available online. And last slide, please. For the conclusions and recommendations of the policy paper, I just want to go quickly the policy actions the paper presents. So short-term, governments need to react. It's not a matter of finding the right solution, but they need to deploy these contact tracing apps or services. And then they need to involve people in the communication. I think that's crucial. And then eventually, and if you read the paper in detail, they need to adjust their services. They need to revisit, for example, data protection and privacy legislation. They need to react, resolve, and reinvent. And then when they reinvent, they probably need to come back to first stage again and react. So that's a cycle that governments need to go, because the technology is evolving too fast. 1 month ago, what we think about contact tracing apps is not the same right now. A lot of improvements are happening, and a lot of improvements also in the privacy and protection side. So this cycle needs to continue, and I invite everyone to look at more details in the links provided in this presentation. So thank you so much, and back to you.
Thank you so much, Denise. So we can move to the next slide. We have a few minutes for a Q&A session. And again, just a reminder to all to please keep putting your questions and comments on the WebEx and the Q&A. We will try to address as many as possible. We are also compiling your questions because they are helpful for us in making the analysis later on for further policy briefs as well. Denise, I think you still have your mic open. So I'll be posing a few questions to the speakers. Shantanu, I have one for you. On your first recommendation, COVID-19 has made science and government and digitalization more important. What does this mean for different types of science policy interface? For instance, chief scientists speaking truth to power, dialogue models, and combinations in different contexts. Yes, and then I have one for Dennis. Could you please elaborate the role of entrepreneurs during this crisis caused by COVID-19 while considering developing and less developing countries? Shantanu, can we start and then over to you, Dennis?
Okay, thanks, Nara. That's a great question, and maybe we need another policy brief to answer that one. But I think I'm just going to ask, I'm just going to respond very quickly by saying that the broad principles about how governments react to advice are basically to ensure accountability, to ensure transparency, and to ensure rootedness in evidence. Now, some governments already have science advisory positions, and that is important. It's an ongoing dialogue between the policymakers and the scientists that the science advisory position facilitates. But I think one of the things we've learned from the COVID experience particularly is that this is also a way to tap across science capacities which may not be there in government itself. So I think recognizing that when there is external advice coming in to inform the government, or even internal advice, who's providing it, how accountable they are, making it public so that people who may have genuine differences on the scientific basis are able to comment, are all important ways of actually making science advice itself more influential, but also more accountable within the policy-making process. Some of these would not have been possible earlier, but I think we are now in an age where there is openness, where there's greater pressure on openness, and this should be encouraged in science policy advisory systems. Over.
Thank you, Shantanu. Dennis?
Yeah, I think the question about entrepreneurs is very important, and it comes back to public-private partnerships. And I think most of the innovative, quick-to-market solutions are coming from private sector. So it is in that regard, since technology, use of technology is more advanced or easier to deploy in private sector, I think there is lots of room for partnerships, and also to widen the internet access, the partnerships with mobile operators, or the partnerships with providing access to internet. That's very important. Another way is this using any kind of channels to reach out to citizens. So we see a lot of partnerships providing accurate information. Again, it is important. There are a lot of examples of this in the paper, how partnerships are helping, but entrepreneurs are crucial, I think.
Thanks so much, Denise. Shantanu, I have another one for you. Regarding recommendation 3, share knowledge and data for collaborative research, What is you and DESA doing to make sure that such knowledge and data are reliable and trustworthy?
Thanks, Naira. I think all of the data and information we put out goes through a very clear review process at our end. And this review is through experts, and also it is often sourced from recognized experts as well. So one of our inbuilt check is actually to have this kind of review, but we also have a more open check, which is that when we put data and information out, whether it's a publication or whatever, it's available free of charge for everyone to see. And if there are inconsistencies or differences, they just have to write in, and we take a second look, as we have done often with some of our reports and publications. So I'd like to also thank everyone who's taken the trouble to do that. Over.
Thanks so much, Shantanu. Denise, we are receiving several questions that are addressing a very similar concern. So I'll read a few of them and that you can elaborate. So there are two coming from Facebook Live. In terms of alerts and monitoring for COVID-19, how to reach the most remote populations where communication services such as telephone and internet are scarce? And also there are questions mentioning that a huge number of people still do not have internet access, and how to ensure access to digital services as well. So over to you, Dennis.
Thank you. I think we are going back to what USG said. 50% of the world don't have access, and they don't have the luxury to what we are actually doing right now, or what our children are doing, connecting to schools. The access, it is crucial, not only during this COVID-19, but to achieve the SDGs. So like some people who don't have access to fast internet, to broadband, for example, one technology that we are using and we are exploring, we are experiencing in the applications is the SMS. Again, I know that it's a bit contradictory, but people without internet access, but with only mobile phone access, reaching out to them via SMS is one way. But radio, TV, still many in rural areas, these are widely used, and while it's far from our lives, listening to radio, it is common and it is used. It's a technology. More community centers, village internet points, village access points. Again, it is very debatable how efficient these are, but these are also used. But I think this question is very broad, and it is going back to affordability and increasing people's incomes, and also partnerships with mobile operators and private sector companies, and providing access through that. So it's a very difficult question. The answers are not in there, but there are small steps. We are moving to that direction.
Thank you so much, Denise. ASG Spatolisano, I have one question here coming from Facebook, and if I may, I will pose this question to you. And what do you see as the silver lining in the COVID-19 crisis? We can, I don't know if you have your mic open, or if you want, we can also come back to close the session with this response.
It is okay. What did you say? It's not 100% clear. What is the?
So the question is, what do you see as the silver lining in the COVID-19 crisis?
Yeah, well, one question like this offers the opportunity to highlight that in spite of the fact that there are very grim figures out there and very many difficulties at present, each crisis, of course, is an opportunity to learn and do better in the future. And I think we even in the current predicament, we see already hints or examples of communities coming together to respond to the crisis and the difficulties of individuals who are more vulnerable, even when the institutions may not be as prepared or reach out as fast as they should. So there is, especially in the global south, I think we have witnessed some of this community capital, if you want to call it that way, which is how to say, encouraging for the future of humanity. But at the same time, I think the exposure of the vulnerabilities of our societies and systems should encourage us and bring us to build back better, as I was saying earlier. For instance, derive from this crisis the concept that we need to have better social protection systems in our societies so that when if another crisis arrives, we are better prepared, and this kind of things. Looking at informal sector and trying to make it easier for people to have formalized form of jobs so that they can be reached to more easily when they are in need, and this kind of lessons we can learn are, I think, the indication that it can be done better, and we will. Thank you.
Thank you so much, ESG Spatolisano. Shantanu, I have another one for you. In your view, what is the role of UN mechanisms such as the CSTD and the Science, Technology and Innovation Forum to facilitate the implementation of the recommendations proposed?
Okay, thanks, Naira. I think there are many ways in which these UN mechanisms work. The Science, Technology, Innovation Forum for people who may not be so close to UN processes is an annual event which brings different kinds of stakeholders together. The CSTD is the Commission on Science, Technology and Development, which is an intergovernmental process that agrees on better collaboration among I think from our discussion on the Science Policy Society interface, it's clear that there are many different people involved at different levels in actually translating science into good policy that works. Also in sharing knowledge about innovations, and also as well about actually promoting the global partnership around these aspects, which will actually effectively change policy at the country. I think all of these UN mechanisms help in one way or the other. And I think a very important role for the UN system also is to address the capacity gaps. I brought up briefly in the first part of my presentation. There are many countries where the effective sort of science policy national or local systems are simply not there. I think right now there is a huge amount of access to scientific information which wasn't possible earlier. So how to make sense of this, even if you don't set up science advisors in your own country, but how to use this as a way to guide your policy forward? How can you strengthen the collaboration with businesses and academia so that the science-based recommendations are taken forward are all ways in which the UN system can help to build up at the country level. We have programs within the TFM like Science, Technology, Innovation roadmaps that help bring this out. And we also have great experiences in being able to draw upon innovators from across the world who enter our various competitions to showcase these efforts so that people can learn from each other, even where, for example, as Dennis pointed out, internet connectivity may be a problem, but the application of technology to advance well-being can be done in different ways.
Thank you so much, Shantanu. I think we have time for one more, and I'll give this one to Dennis. Dennis, we have a few questions here about privacy, reliability of data, and protection of personal data, especially regarding to the apps that you mentioned. Have you already spotted good practices in terms of, doing the work that related to COVID-19, but at the same time protecting privacy of individuals?
Yes, Naira. So, first of all, I've also seen a few questions about the privacy and what the paper and suggests is anything developed in that regard should respect human rights and privacy and general principles. So that's having said that. What a quick review of the apps show that most of them have no privacy policy. That's something I think where getting consent of people to use the apps is very important. And I mean that's a big issue going on as came up a few times. So these AI or apps will automated algorithms. I mean, will generate both also false negatives and false positives. Apart from privacy, I think the trust on these apps should be approached with caution. So those are not the online contact tracing is not the actual solution. I mean, real in-person contact tracing done by health officials, that's much more efficient and productive in my view. This is not directly related to this privacy, but in a way related because this is just, I think, can help health officials for improving the efficiency and accuracy of data management, automating tasks. I'm talking about contact tracing apps, or reduce the burden of data collection. But I just want to put this out there that we should also be very cautious about the efficiency of these apps, and not in a way suggesting use or not use, but just a general feedback. And whoever is developing government or private sector, this Google and Facebook are now developing their own contact tracing app. There should be the first thing should be user consent and privacy in line with human rights. Back to you.
Thank you very much, Denise. Thanks so much, Shantanu. And to all for the great questions and inputs and comments. We will move now to the next session and the next slide. Before we start, I will just ask once again everybody to please, can you make sure that you have your microphones muted. But now I want to ask you all to also turn off your cameras. I see that we have several colleagues with the cameras on. If you can see yourself, this means that your camera is on. This would be very helpful, because then we can all focus on seeing the speakers when they are talking. So just turn it off, and it will show red or on your WebEx screen. So thanks so much for the collaboration. We will start now the second session. The second session of this webinar is focusing on COVID-19 and inequality. And this session will focus on this policy brief called Responses to the COVID-19 Catastrophe Could Turn the Tide on Inequality. Again, as I mentioned, you can have access to the briefs at the UNDESA COVID-19 dedicated webpage. We have two presenters for this session. We can move to the next one, and I want to introduce the next speaker, which is Mrs. Marta Roig. She's Chief of the Emerging Trends and Issues in Development section of the Division for Inclusive Social Development at UNDESA. Marta, you have the floor. Thank you.
Thank you very much, Nayara. Can you hear me?
Yes, we can hear you very well.
Perfect. Thanks very much, and greetings to everybody. Let me just start by highlighting that although this is certainly a massive human crisis and a tragedy that's affecting many of us directly, there's still a lot we don't know about the crisis and especially about its long-term effects. There are many reasons to be fatalistic. This can certainly become a systemic and protracted social crisis and can exacerbate inequalities. But in the long term, much of what happens depends on the policy responses to the crisis, especially during the crisis aftermath. So let's move to the first slide and start with what we know about the crisis and its social effects. We know that the crisis is already having an unprecedented impact on employment. The ILO estimates that the crisis will have costed more than 300 million jobs just by June of this year. And it's worth saying that the ILO has been revising its estimates upwards every 15 days since the beginning of March. So the total number of jobs lost may be much higher at the end than what's shown here. We don't know that small and medium-sized enterprises and own account workers have been disproportionately affected by the crisis as well. They are a high proportion of workers in the sectors most affected by the crisis, including retail trade, the restaurant and food sectors, and so on. We also know that informal workers have already seen their earnings decline by more than 50%. Only the first month of the crisis, and these workers have limited access to social protection. So for all these reasons, we can safely assume that unfortunately poverty is increasing and will increase as a result of the crisis. Preliminary estimates from very reliable sources are quite have a big range right now, but all indicate that poverty will increase, whether it's by 50 million or by 450 million, which are the highest and lowest estimates given right now. Poverty will increase. And by doing so, it will break a historical trend of declining inequality. In fact, next slide, inequality had been declining since the 1990s. As you can see here, the projections made, these are by the World Bank, indicate that poverty will again increase for the first time in 2020. You can see the difference with the projection that was made before the crisis hit and after the crisis hit. What the crisis reminds us actually is that there are many people who live close to poverty, and any shock, even a shock smaller than the current one, can throw them into poverty. But it also reminds us that poverty is a condition that can affect any of us at any time, that it's not something that affects a fixed set of people, right? We are all at risk of falling into poverty. So for all these reasons, inequality, and on next slide, please, inequality may increase as a result of the crisis. Of course, the crisis affects, the virus, both the virus and the economic crisis can affect everyone, every country, every group of people. But there are inequalities in both exposure to the virus, vulnerabilities to its outcomes, and the abilities to cope with both the health and economic consequences of the crisis. In terms of exposure, living and working conditions matter. People living in high density and poverty are quite related. People living in small and crowded dwellings, for example, cannot physically isolate. People living in slums that are very dense in cities of the developing world cannot isolate. People living in homes or institutions, such as jails or in refugee camps, have trouble isolating as well. Frequent hand washing, which is recommended to avoid infection, is difficult for the 3 billion people who do not have hand washing facilities at home. And then there's also we have already talked about the digital divide, right? Access to information is unequal. Not everybody knows how not to get exposed. And then in terms of working conditions, Many of the workers doing the so considered essential tasks at this moment are low-income workers. There's smartphone data, at least for the United States, that shows that after the government, several state governments decreed a lockdown, low-income areas remain much more mobile than high-income neighborhoods because people had to go to work. They cannot work from home. They could not afford to stop working. Next slide, please. In terms of vulnerability to the crisis, of course, the severity of the disease once someone is infected depends partly on whether the person has a pre-existing health conditions such as diabetes or lung disease or cardiovascular disease. People with poverty and members of other disadvantaged groups, older persons as well, are at higher risk of having pre-existing health conditions. The graph in this slide shows how cardiovascular mortality varies by educational level, which is an indicator of socioeconomic status, right? The darkest blue bar shows that mortality by cardiovascular disease is much higher among people with lower levels of education, both in low income and in high income countries. So vulnerability to the outcomes of the disease are unequal as well. And then the ability, next slide, please. The abilities to cope with both the disease and its economic impacts, and with the impacts of the policies put in place to avoid the health crisis, are unequal as well. Obviously, the ability to save is conditioned on people's income. There was an article in American newspaper, I think it was last week, showing that in the United States, people with high incomes can save the equivalent of 4 weeks of expenses in about 2 months. People with low incomes who have an ability to save, it would take them from 2 to 3 years to save enough to cover 4 weeks of expenses, as an example. And of course, there are groups, and I have to highlight the experience of women here that experience overlapping disadvantages, and as a result are at higher risk of both the virus and of falling into poverty. Women work disproportionately in the informal sector, and at home, the burden of care falls disproportionately on women as well, and both as a result of the health crisis and the lockdown, care burdens increase. Women are also the victims of domestic violence, which has been proved to increase during lockdowns as well. So as a result of all these inequalities, next slide, please. People living in poverty, including low-wage workers, women, and members of other disadvantaged groups, from migrants and refugees, members of disadvantaged ethnic minorities, indigenous peoples, persons with disabilities, stand to lose more during the crisis than other groups. And so as a result, the crisis can push inequality upwards. And the impacts of this crisis and the impacts on inequality can last for years and may even affect the next generation. But as my colleague Shantanu will explain, the long-term impacts of the crisis are not set, as I said. The crisis presents, as we indicate here, a fork in the road. An insufficient response to the crisis can not only exacerbate inequality, but also intensify public discontent and affect trust in institutions. But as Assistant Secretary General Spatolisano has said, the crisis brings new awareness of the importance of strong social protection systems and strong public services. In fact, in the long term, earlier crises, both pandemics and wars and other big crises, have in many cases helped to level income distribution and reduce other forms of inequality. Let me say just by finishing that the findings that I'm presenting are from a policy brief that was prepared by several colleagues, including Astra Bonini and Shantanu Mukherjee, who will present right now, and Jörn Feili, in addition to myself. Thanks so much, Nayara, and back to you.
Thank you very much, Marta. We can move to the next slide. And to continue this conversation on COVID-19 and inequalities, I want to invite Shantanu Mukherjee again. He's chief of the Integrated Policy Analysis Branch at the Division for the Sustainable Development Goals of UN DESA. Shantanu, the floor is yours.
Thank you, Naira. Thanks, Marta. And let me just continue with where Marta left off by raising this point that what really struck us when we were looking at the question of inequality in terms of impacts was how inequalities along many different dimensions were getting translated into in unequal impacts due to COVID. Marta mentioned the situation of women, where it was not just income or not just health. It is something more that's going on there. But because of COVID, this is translating into a different kind of impact. And who could have thought before the crisis came that access to water for being able to wash your hands was going to be so important? So I think one of the big lessons we've actually been learning from this analysis is that even though the impacts will take a long time to unfold, if there are inequalities in your society, not just about income or wealth or anything or access to services, these are showing up as very different forms of disadvantage. And if we could have the next slide, please.
Is that models that you see and a lot of the graphs that you see talk about
All right. So now, apart from the inequalities across different population groups and countries, I just want to reiterate the point that inequalities across countries also is evolving over time, depending on impacts. But it is sort of unequivocal right now that the progress one saw in the last decade or more about a convergence between countries towards being able to move out of the most basic deprivation, such as being able to eradicate poverty, extreme poverty, or being able to get rid of many infectious diseases, or being able to move towards eradicating hunger. All of these are now at risk. And so even along this dimension of being able to eradicate basic deprivations for their citizens, we are seeing again the risk that there will once again be movement away from this, so that we are going to be in situations that we were perhaps a couple of decades ago, when many of these sort of very fundamental weaknesses in people's well-being start to return in large parts of the world. Next slide, please. Now, Marta mentioned that this is, of course, not inevitable. And a lot of what happens for the future, it is determined by the policy responses we make. Our past reading of crises of this magnitude shows that actually big responses are possible. There's a rethinking sometimes of the social contract. There's a rethinking of the way in which public goods are provided. And we see this in the aftermath of the Second World War, for example. We see that there was huge expansion in public service and new programs. We see this in the aftermath of the Great Depression, and more recently in Latin American countries, the response to the Great Recession reduced inequality. So certainly there is scope for building a much more equal future for us, and a future in which sort of inequalities in various dimensions will not turn out to produce vast inequalities in outcomes when the next crisis hits. So this brief actually makes 4 points in this regard. The first point is about expanding systems for the universal provision of quality public services. Now, COVID-19 has been a stress test for all countries in terms of providing services, and all countries have come up short in different ways. But I think we can take away the point that we need to accelerate how the universal provision of services like healthcare, like sanitation, like social protection, of course, but also things like education and access to technology, access to the internet. And we need to ensure that when we set these up, all people have access to them in ways that make sense for them. So if poverty is a barrier, we need to find a way around it. If stigma and discrimination are challenges, we need to find a way around it. We find, for example, that the people with disabilities, often a big barrier for them in the current situation is that they can't access services they rely on. So clearly there has to be a little bit of forward thinking in terms of how the service delivery itself is managed so that these barriers are removed. We find in many countries that systems were just not prepared to deal with a huge surge in the kind of expectation that was made of it. So there's definitely a need for preparedness planning for this. And critically, we also find that maintaining the fiscal space during times of crises for delivery of these services is essential, whether this is done through counter-cyclical spending measures or prudent debt management or eradicating tax evasion and so on. It is a recurrent feature of crises that when the need for fiscal spending is the most, revenues are also the lowest. And so this management of the systems prudently is extremely important. The next point that I'm making here still with this slide is that while we provide these services, we have to empower also the vulnerable groups for several reasons. The first is that this crisis is showing very clearly that different groups have different levels, are experiencing the impact in different ways. And it is not only important to reach them, it's important to understand what's going on with them. I mentioned in our earlier brief that it's important for disaggregation of data and disaggregation of information. And we must be able to understand how different groups are being affected and how the policy support that is being provided is actually instrumental in improving their lives or not. And I think here we also need to be able to understand that that providing this information and data suitably disaggregated is a huge way of empowering people to demand accountability from their systems, and therefore it has additional beneficial effects as well. Of course, capacities to do this vary, and there are many ways to improve the investment in building this capacity. The UN has a big role to play here, and this is something we hope will come about as recognition to the importance of managing this kind of disaggregated, not just data collection, but actually response in response to crises. Next slide, please. Two other quick points before I close. Previous crises have shown that sometimes the effects of inequality that happen during the crises are long-lasting, simply because the lower income jobs that are lost during the crisis are slower to come back, even as the higher income jobs return first. And I think there are risks this could happen again. So what do we need to do? We need to recognize where the lower income jobs are that are being lost and to facilitate how they can come back. Whether it is through providing proper protocols for safety and medical care to returning workers who are often deemed to be essential but may not have such protections. And also to recognize that if we are in fact going to strengthen social protection systems, public service delivery, this is actually an opportunity for large numbers of additional jobs, additional ways to deliver services being created. And these are providing options for new kinds of employment to people. Such is also the case with the shift to greener sectors of the economy, which may come about through properly targeted fiscal stimulus packages or a winding down of some sectors that are badly affected. But clearly one has to be proactive in also preparing for the skills transitions that are needed to meet these jobs. We have to invest in those jobs and livelihoods that particularly impact the well-being of the lower part of the economy. And finally, I would just say that the multilateral system has a big role to play here. A big part of the United Nations work is to improve coordination and foster partnerships, including around building capacities and helping bring technical strength in some of these systems we're speaking about. I think we also have an important role to play, not just the United Nations, but the entire multilateral system in taking care of restrictions of various kinds of flows across borders that may make things worse. We hear about possible trade restrictions on food, which could actually make starvation levels surge much more, or malnutrition levels surge much more. There are restrictions on liquidity. And I think the international system does need to gear up to be able to take care of those. And finally, of course, every country is under stress right now, but this pandemic is also something which cannot be stamped out unless every country stamps it out too. And recognition of this need for solidarity, I think, needs to guide some forward-looking investments, such as meeting the international development cooperation commitments, increasing concessional finance, and helping deal with debt situations in countries that are restricting their fiscal space. So taken together, I'd just like to wind up by saying that our brief is called the possibility of COVID turning the tide on inequality. And we firmly believe that the scale of this disaster can be transformed into a positive action if countries meet it with a scale up.
Thank you very much again, Shantanu. We can show the next slide. So we are moving to our second and final session of questions and answers. Again, just to remind everybody, the link to the recording and also the link to the PowerPoint will be shared with all the registered participants, and will also be posted at the DESA dedicated COVID-19 website. We have a few questions coming through. I'll be presenting then, trying to propose them for either Marta or Shantanu, but you also feel free to jump in if you have if you want to complement, since you both addressed the inequality and COVID-19. So Marta, perhaps you can address this one if you have more more ideas, suggestions, recommendations on how to address the challenges in the educational system in developing countries. Over to you.
Thank you, Nayara. I think right now, in the short term, the main obstacle to a continued education through the crisis is obviously the digital divide. So the first thing we have to do is to ensure that the infrastructure is in place and that people are adequately connected to be able to continue their education. That's in the short term. And also, I mean that then social protection plays a role as well, because we also have to prevent children from going back to the labor force because their families have fallen into poverty, right? So this is in the very short term. In the long term, as Shantanu has stressed, this is an opportunity to strengthen public services that have proven to be quite effective, not only in developing countries, but in developed countries as well. That goes for the healthcare system, but also for education systems that are obviously not providing the same quality education to everyone. So this is a stress test. The crisis is a stress test. It's also, as Spatolisano has said, an occasion to build better and to strengthen both health and educational systems.
Thank you so much, Marta. Shantanu, we have a few questions that are coming about the technological revolution and job market. So I'll read as it came to us. The technology revolution has already polarized the job market with an increasing skills and inequality between the skilled and low skilled work. And up to what extent does the current crisis further accentuate the polarization? And I also see if you have thoughts about how to retrain or bridge the gap for people losing jobs to technology to technological advancement and yet keeping people gainfully occupied?
Thanks, Naira. So obviously, this is a question which is colossal in its scope. So let me just share a few quick thoughts. Indeed, there has been a widening gap between the returns to skills of low-skilled and high-skilled workers, and even medium-skilled workers, those who were in previously occupations that were previously considered kind of stable and well-paid, are at risk. Now, the question is really, what can we say about the impact of this crisis on this kind of differential returns? On the one hand, you could argue that people who are working at the higher end of the technology spectrum, who are better able to work remotely, for example, and observe social distancing or economic lockdowns without exposing themselves to harm, as Marta pointed out, are inherently going to fare much better, not just in terms of retaining their incomes, but also retaining their health. On the other hand, many of the workers who are working in lower paid occupations are probably also exposed more to the health risks of COVID. So, but I think if we look forward a little bit, some of the things that this crisis is bringing out is the need really to step up the public service delivery on the care side. And when we talk about, let us say, more extensive contact tracing, what does this mean? This means shoe leather. You have to go. It is not just a question of apps. Apps are important, but also going house to house, persuading people to actually stay indoors or observe health restrictions. These are also just as important. When we talk about improving how education is delivered, we are talking about assistance in tutoring children for whom the straightforward, who may not have access to the internet for remote classes, who may not have, for whom this teacher-student ratio of 40 students to one teacher, whatever it is, may be too extreme in social distancing periods. So I think there are opportunities also when we invest in providing services into also investing in providing the kind of jobs to which transitions are possible. And these may actually help out in the longer term.
Thank you so much, Shantanu. Marta, we have one for you coming from Facebook. To reduce inequalities, policies should be universal in principle, paying attention to the needs of vulnerable people, including older persons and persons with disabilities. Would you have recommendations on how can governments work together to promote universal social protection for all and provide fast stimulus plans during crises like COVID-19?
Thank you, Nayara. First of all, yes, indeed, countries that have social protection systems in place, comprehensive social protection systems in place, have been better in addressing the impacts of the crisis already because they have automatic stabilizers in place. When the crisis hit, they were able to provide either unemployment assistance or the assistance necessary for companies to keep their workers in place, just to put an example. So indeed, it's better to have better, more effective, and even cheaper to have comprehensive social protection systems in place when a crisis hit than to have to build from scratch through fiscal stimulus plans that may provide relief in the short term, but that will disappear eventually and will leave people as vulnerable to the effects of the next crisis as they were before. In terms of building comprehensive social protection systems, look, the ILO has done a significant amount of research showing that at least implementing a basic social protection floor with basic systems in place to protect children, people who are unemployed, older persons, and so on, is affordable for most countries of the world. when it is not affordable, and it's not affordable, I don't remember the number of countries, but for a number of low-income countries, it's not affordable, then that's where the international community must step in. And this crisis proves more than ever the importance of stepping in and helping these countries build these social protection systems, right? Because the lack of healthcare, in this case, the lack of any social protection measures affects us all. If people cannot go to a hospital and get healed quickly, we all suffer. So yeah, that's it.
Thanks very much, Marta. Shantanu, I have one for you that it's a follow-up from what you were discussing in your presentation. So there are quite big gaps between developed and developing nations, as well as within a country in terms of education, knowledge, science, and connectivity. So how do you see the role of the United Nations in supporting bridging this gap?
Okay. I think when we speak about the role of the UN in this context, we have to understand that wherever the UN is successful in bridging these gaps, it's always because it's working with policymakers, with civil society organizations, with businesses and other partners on the ground. And I think the support the United Nations provides extends along a whole range, depending on how ready the country itself is to address some of these gaps, both in terms of the policy making, but also in levels of investment and what is feasible in each. So, for example, there have been cases where the United Nations has worked extremely well through advocacy and raising awareness of gaps which many people may not have known were even existent or may not have been aware were important. And here, I think a big part of the United Nations role is actually engaging with the civil service communities with helping provide high quality evidence and information that can be used. Yet another role of the UN over here is actually to strengthen capacity to meet some of these gaps, often through often these days, through actually innovative technological and other solutions. These can end up helping people learn from countries to learn from each other on how to do this. A strong program that the United Nations supports is capacity building for central registration systems, which are absolutely essential if you're trying to find out what the gaps are across people and where they exist. So compulsory registration systems and this kind of data collection, I think the United Nations helps people establish and get better at. And of course, there are dedicated programs. When I speak of the United Nations system, it also includes partners who invest financial resources in building up technical capacity in countries and in actually rolling out things like social protection platforms, our partners in the World Bank, in ILO, and so on. And these are also ways in which this kind of information or this kind of help is provided. And finally, I would just say that here we see that a big part of this crisis is a humanitarian crisis where people are falling into hunger, ill health is spreading. And I think all of our humanitarian partners in the United Nations system are actually well poised to deal with this. It's just a question of having the right kind of resources for them to roll out their tremendous capacity in dealing.
Thank you, Shantanu. Marta, we have a question coming from Africa. So the question is how, if you would have specific recommendations for countries in Africa, especially those that have not been put into social distancing or lockdown or more restrictive measures yet, if your analysis brought some ideas for those countries as well.
Thank you. Thank you, Nayar. I'm sorry. I have mentioned some of the challenges that, excuse me, people living in poverty face to follow the necessary recommendations to avoid infection, right? From living in small and crowded dwellings to living in slums that have high density. Many of these challenges apply more than in any other region to Africa because the proportion of people living in poverty is much higher in this region. Adding on to these challenges is the fact that attention to diseases, other infectious diseases, especially that affect disproportionately the continent of Africa, has been withdrawn in funding to address those diseases has been withdrawn because all the funding is redirected towards COVID. So there's a double challenge that they might face: the one brought about by this health crisis and the one brought about by other diseases that are being disregarded. I think again, I mean, the international community must step in here. I don't know that the region alone can face this crisis, can address this crisis. The international community must step in here. Obviously, there are things that the continent has to do in terms of starting to bridge the digital divide and in terms of strengthening social protection systems. But I think without coordination and multilateral action, the crisis will not be defeated. I was wondering, sorry, Nayara, I was wondering if the other co-authors of the brief maybe have something else they can also bring responses to some of the questions. Sorry.
Hey, thanks so much. So I will.
I think Astra is online, actually. Yeah. I see her.
Astra, would you like to come in? You are muted. Yes, now you can go.
Hi, Marta. Thank you very much, Nayara, as well, and Shantanu. You can hear me?
Yes, we can hear you well.
Okay, thank you. No, I think that Marta and Shantanu have both covered many of the issues in so much detail. I don't have a lot to add. Just to respond to a couple of the questions that have come up and reiterate the point that one of the things that's happening with the COVID-19 crisis is the exposure of inequalities that have been there for a long time, several groups that have been marginalized and may have had less access to healthcare, to many of the resources, social protections that are needed, but also some of the things that have not been so visible in discussions about inequality. Access to the internet is one of them. Access to resources to battle domestic violence for women. Access to alternative forms of learning for children. So moving forward, not only will it be important to address inequalities in income and wealth, but also to really shine some lights on inequalities that were not as close to the forefront of discussions about inequality in the past. Thank you.
Thank you so much, Astra. I think we still have time for perhaps two more questions, and just I would signal to the speakers, including Dennis, if he's still on the call, that at the end I would just offer you 1 more minute to give some final comments if you want. Marta, there is an idea that came from Facebook Live. Perhaps you want to comment on that. And I'll read. The COVID-19 is pushing humanity into dire social crisis. In the future, would it be possible for governments to include a specific form of individual insurance for cases of humanitarian crisis as a means of social prevention and guaranteeing assistance? Something in the same model as health insurance and unemployment insurance. Have this type of idea been already discussed or floated or proposed?
Well, an idea that has gained increasing traction even before this crisis hit is the idea of a universal basic income, because in many countries, employment is becoming increasingly insecure, and you know, we are experiencing many and more challenges as we move forward because of climate change, because of economic crisis or the pandemics that are hitting us all right now. The idea of universal basic income has been more and more discussed. And it's something that would help. Again, it would be an automatic stabilizer in the case of a crisis like this. People would not find themselves in such dire situations if they had an income coming systematically. Of course, universal basic income is costly. Providing it would mean that many of the social protection programs that are currently in place to assist people living in poverty or for other reasons would have to be dismantled. So it's not free, there are pros and cons, but it's an increasingly attractive idea for many governments.
Thank you so much, Marta. Astra, do you want to come in? I see you unmuted yourself, so just want to make sure.
If I can just add to what Marta said for a second.
Of course, Shantanu, please feel free.
I mean, I think this question is also tied to one of the ideas that underpins the 2030 agenda, which is the idea of a social protection floor. And the whole point of a floor is that it provides solid support when you happen to fall on it. So you don't fall through any gaps in the floor. And I think the challenge, as Marta pointed out, is how to ensure that there is a kind of universal coverage to which everyone is entitled, but at the same time, making sure to balance the costs. So, for example, we see already that when these crises hit in a big way, the impacts are unequal. So a person who has lost their livelihood arguably deserves much quicker attention than a person who has not. And so I think any kind of universal scheme also has to balance what is going to happen when a problem of this magnitude hits, so that the response is universal, but it is also provided with greater priority to those who are most at risk or most vulnerable.
Thanks, Shantanu. So I have a final question also to you, Shantanu, and then we'll move to the closing remarks. I think there might still be some background noise on the call, but Petra, if you could just double check. So the final question, Shantanu, what role do you see for the rule of law in dealing with the crisis and its outcomes?
This may be something on which Marta and Astra might have something to say. I think they have a bit more experience on this side. Of course, I can come in, but I think they're better suited. Over.
Marta, Astra, over to you. Yeah.
See, there's a big silence. Look, I mean, this is a big question that's hard to address in an answer like this. So anything I say is likely to be to be short. But the functioning of institutions depends on the rule of law. If there's in countries where there's no rule of law, one cannot assure that public services function well and service everyone regardless of where they live or who they are. Social protection systems may be clientelistic; they may not serve those who need it the most. So I think any coordinated response that is effective requires the rule of law. Just very basic response.
Thank you, Marta. I just want to check if Astra, if you want to come in.
Thanks, Nayara. I would just reiterate what Marta has said and also emphasize that even in systems where universal services are available and provided, there can still be discriminatory norms or even legal restrictions that do not enable all groups to access the services. So this is an area where focusing on the rule of law and looking very closely to make sure that there are not restrictions in place that make it impossible for people to access clean water services or to access healthcare are not in place, and to make sure that any regulations can be brought in to support access to those services. Thanks.
Thanks very much, Astra, and also for all colleagues, just to let you know that there are a few other policy briefs that are coming up and being coordinated at you and DESA. And there will be one that will be addressing those issues more related to the Sustainable Development Goal 16, that includes rule of law. So we are now moving to the final closing remarks session, and we can go to the next slide just to share with you how you can keep in touch with us. I want to invite our speakers, and I will give the floor finally to ASG Spatolisano for very quick final remarks from you. Let me start with Dennis, then Marta Chantanou, and then I'll give the floor to ASG Spatolisano. Dennis, just some final thoughts?
Thank you, Nara. I hope you can hear me. This was very helpful. Thank you, everyone, for the questions. I mean, I just want to reiterate that related to these COVID-19 e-government services and applications, I've noted many questions about the human rights of people. I mean, what we suggest, what we advise is the same rights that people have offline must also be protected online, and that's the thing that comes from UN Human Rights Council. So any kind of apps or services should be developed with those in mind. And I think our problem, as many participants also highlighted, is these digital divides. In some parts of the world, people who have access dealing with different problems, but the rest doesn't have, and we need policies for that, for bringing people online, and this cannot be left only for governments, and we need partnerships. Thank you.
Thank you, Dennis. Marta?
Thank you, Nayara. Just maybe very quickly to stress again that this crisis is a stress test that has exposed deficiencies in public health systems and in social protection systems, deficiencies that affect people at the bottom of the income distribution and disadvantaged groups more than the rest of the population. And so that we have to respond to the crisis in a systemic way. Emergency measures, including fiscal stimulus plans, will only get us so far and will leave people vulnerable. So whatever we build in response to the crisis should stay in the long term and should have long-term benefits for everyone. Thanks, Nayara.
Thank you, Marta. Shantanu, over to you.
Thanks, Nayara. I think the final point that comes to me after having taken part in this very illuminating discussion is really that a big challenge for us that we have to be mindful about when we go forward is how to prevent inequalities that exist, whether it is in terms of accessing scientific knowledge, whether it is in terms of accessing technology, whether it is in terms of higher quality services. How do we prevent these becoming barriers to everybody's well-being going forward? And I think we need to think hard about this, make sure that as we plan and build back better, as several speakers have said, we are also very mindful that the challenges that are faced by individuals and small groups are just as important as the challenges that are faced on the average by population.
Thank you, Shantanu. And then for final words, our Undersecretary General Maria-Francesca Spatolisano, over to you.
Thank you, Nayara, and thank you all the speakers and all the participants in this webinar. I was looking at the questions from every region in the world, and I'm very proud of this. And this demonstrates the interest of the topics and the timeliness of this debate. I was very well impressed by this participation and the very sharp questions, indeed, sometimes difficult to answer. As we often say, if we had all the answers, of course, we wouldn't be here debating. So the communication and the exchange are part of the path towards solutions. I have noted a few recurring themes, of course, about the accurate information, avoiding misinformation, or the focus on jobs and resilience, and also the future of work and the impact of the digital technologies and this kind of questions which we try to give answers to. Let me add a dimension which I think cuts across all these questions we have, and it speaks to the need of keeping civic space. There is some mic on, I think. So I was saying keeping civic space open and thriving participation of all stakeholders is very important, because COVID and other crises cannot be an excuse for giving authoritarian responses or for giving responses which are more divisive of our societies. On the contrary, accountability and transparency are at the core of democracies, and we, as UN, promote, of course, more accountability, more transparency, more solidarity. You may know that the Secretary General has issued a report at the end of March, beginning of April, called the Shared Responsibility, Global Solidarity, indeed addressing the societies in time of COVID and the response needed. And this report gives a sort of common framework to the whole UN family and UN system to be responding and helping people and governments to respond. So in conclusion, I would say that with this webinar and other initiatives and briefings on our webpage, our department will continue to offer the knowledge and share the knowledge we have, and offer this space for debates to all stakeholders. And at the same time, as part of the UN, we will continue to work with governments to maintain this accountability and to bring about the kind and the level of cooperation, international cooperation, which is required in this crisis and beyond, and rebuild the trust in international cooperation that sometimes has been less forthcoming lately. Thank you very much.
Thank you very much, SG Spatolisano. Thank you to all, especially to our speakers. Again, our SG Spatolisano, Shantanu, Denise, Marta. A huge thank you to all the participants, those that connected through WebEx, those connected through Facebook Live. And finally, I really need to recognize all my colleagues from UN DESA, Pedrag, for managing this call, and I will not list all of you. You know you are behind the scenes, and thank you for all the collaboration and in organizing the session. The webinar is closed now. Thank you and have a happy day. Bye.